Good afternoon, everyone. Welcome to today's webinar. We have a very special guest with us, Dr. Jonathan Kaplan, who is definitely one of my favorite people, industry colleagues to work alongside. Not only is he a fabulous, well-known surgeon, he is also a brilliant entrepreneur, practice owner, and business guy as well. So we are very excited to have him. So really quickly, as many of you guys probably already know, my name is Audrey Neff. I'm the Director of Marketing for PatientNow and RX Marketing. We have a very special webinar planned out for you guys today. We are very grateful that Dr. Kaplan was actually able to come on and invest some time with us today. This is definitely going to be a critical topic that a lot of you guys will want to pay attention to as it relates to the No Surprises Act and how it actually impacts aesthetic providers. So it'll be some great information for you guys. So Dr. Kaplan is going to be presenting for the next hour or so. We'll do some live Q&A. So if you do have questions throughout the presentation, just type them in the webinar question chat box on the lower left-hand side of your dashboard. We have a screenshot here up, so just type in your questions. We will get to them all at the end of Dr. Kaplan's presentation, and then in an hour after we do the No Surprises Act, I'm going to do a course that I did last month for Suniva Medical, and it was very well received. So we're going to, for those of you who attended it, feel free to, if you don't want to, listen to it again, you can bounce off. For those of you who want to stick around, highly encourage it. And we'll talk about some ways to improve lead conversion in your practice. So with all that said, I will turn it over to Dr. Kaplan.
Thanks so much, Audrey. Thanks so much for having me. I really appreciate you and PatientNow for giving me this opportunity to kind of educate everybody on the No Surprises Act. It is a big act, and so it's and not everybody realizes how it's going to affect them on a daily basis, but we're going to get into all that. Just a quick disclosure that I am the founder and CEO of BuildMyHealth, a price transparency and lead generation platform, and now a No Surprises Act compliant platform. When you're listening today, if you feel like, oh, well, he's talking to a different type of provider, maybe he's talking more about insurance and I'm aesthetics, please be patient. I promise you I'll get to the aesthetic side and vice versa. If I'm talking about aesthetics and you want to hear more about the insurance-based effects of the No Surprises Act, I promise I'll get to everybody's questions. And I promise you this act applies to everyone, whether you're doing aesthetics, insurance, maybe a hybrid of both. It's a big act, and most people think that the No Surprises Act only involves the aspect of like surprise bills after going to an emergency room. It does involve that, but it involves so much more. I like to say this is the Trojan horse of healthcare legislation, because on the outside, it just looks like it's about surprise bills in emergency rooms. And most of you think this doesn't apply to me. I don't go to the emergency room and I'm not sending surprise bills. But packed inside of that Trojan horse is all of these requirements involving price transparency that as I go through the presentation, you'll see it absolutely applies to everybody. But the No Surprises Act, it was passed in December of 2020 by a friend of mine who was actually a professor of mine in medical school, Bill Cassidy, and I actually wrote an article with him I'll point out later. But Bill Cassidy was is a hepatologist, a gastroenterologist that specializes in liver disease. And he was one of my professors in med school. And then as I went into private practice, he became a state legislator in Louisiana, where I was originally. And then he became a U.S. congressman from Louisiana. And now he's a U.S. senator from Louisiana. And you're wondering why I'm telling you all this. Well, he went on to be the co-author of the No Surprises Act. He's a Republican, and it was a bipartisan bill that he co-authored with Maggie Hassan of New Hampshire. So Bill Cassidy, like I said, we wrote an article together, which I'll mention a little bit later. But he wrote this act, and it was passed in December of 2020. And if you're thinking, oh, well, I'll worry about this in the future, no, this is already the law of the land. You need to be worrying about it now. It already went into effect as of January 1st, 2022. So we're all non-compliant to some extent, probably. Depending on what type of practice you have, this does not apply to any federal programs, like if you're seeing a Medicare patient or Medicaid patient or any of the others listed here. Those federal programs already have protections against surprise bills, so those patients aren't affected by this. But there are some aspects of this law that apply to all doctors, whether you're providing out-of-network care. So, for example, a plastic surgeon that does breast reconstruction as an out-of-network provider, it affects you. It affects you if you're providing any uninsured care, if you're providing any self-pay services like cosmetic, which a lot of people didn't think that it was involved, but this absolutely applies to cosmetic providers. and some parts of it apply to everyone. So let's start with the parts that apply to everyone. Everybody who is a provider has to put up these public disclosures in their office. You need to put it up by your front desk where people schedule appointments, or whether they make schedule surgery there, or whether they're paying bills at that front desk. Wherever those things are happening, people scheduling things, people paying for things, you have to have these two public disclosures up by that desk on the wall, physically posted up there. And the two things are the standard notice regarding patient protections against surprise billing, so just letting them know that they have protections against surprise billing. And then the other notice is that they have a right to receive a good faith estimate, and I'll get into more detail what that good faith estimate is. But you have to post these physically in your office, and you have to put them on the home page of your website. But you don't have to post the entire notice on the homepage of your website. At the very least, you have to have a link to those posts somewhere else on your website. So the link has to be on the homepage, and then you can link to a blog post or something like that where you have both of these notices. You can email me at Jonathan at the email address on the screen, jonathan@buildmybud.com, and I'll be happy to send you a link to both of these notices that you have to put on your wall and you have to put on your website. Now, getting into the No Surprises Act, again, I know just people think it's just about surprise bills in emergency situations, but it's about much more than that. Just think of it this way. I like to think of it as kind of this overarching goal, and then I'll talk about how I divide it into two parts. But the overarching goal is to avoid sending patients surprise bills. That's the idea. And the way you avoid sending patients surprise bills is you let them know about their cost ahead of time. That's where the price transparency requirements really come into play here. And the way the No Surprises Act focuses on this is they focus on two groups. First, they want to reduce surprise bills when patients are using insurance, and they want to reduce surprise bills when patients are not using insurance. And it's very important to think of it in these two ways, because the rules, the nuances, the regulations, the estimates differ based on these two groups. So let's start with reducing surprise bills when patients are using insurance. Let's say you are on a bike, you fall off, you fall on your arm, the ambulance comes and picks you up, takes you to the emergency room, you're seen by the ER doctor, they send you for an x-ray in the radiology department, they take the x-ray, the radiologist reads the x-ray, says you have a broken arm, they send you back to the ER doctor splints your arm, sends you home, tells you to follow up with an orthopedic surgeon. So in the past, you could get potentially an out-of-network bill, because what will happen is you go to the ER and everybody took care of you, you got treated, but then you get these bills weeks to months later, and you'll see that the ER doctor's bill was in network. They were part of your network, or whatever your insurance was. The hospital was in network. The x-ray, when they took the x-ray, the radiology department was in network, but then you find out that the radiologist who read your x-ray was out of network, and the ambulance that brought you to the hospital was out of network. And what that means is that if you have no out-of-network benefits with your insurance plan, then you're on the hook for the full cost of that radiologist reading of that x-ray, and you're on the hook for the ambulance ride also. But so that's if you don't have any out-of-network benefits. If you do have out-of-network benefits, well, that's good. You'll have some help from the insurance company. However, typically out-of-network benefits means that you have a higher deductible, a higher out-of-pocket maximum for that calendar year, and a higher co-insurance. So yes, the insurance company may pay for some of it, but you're going to be expected to pay a higher out-of-network bill for those services from the radiologist who read the x-ray. Now with the No Surprises Act, that out-of-network bill from the radiologist has been outlawed. So in an emergency situation, you cannot get a surprise bill from the radiologist who may be out of network, or the anesthesiologist who may be out of network. They have to send you an in-network bill. What that in-network bill is a little more complicated, and we'll get into that in a second. But the No Surprises Act outlaws those surprise bills in emergency situations, unless you're talking about the ambulance service. The ground ambulance services, they are exempt from the No Surprises Act, because when they're writing the bill, they felt like, well, you know what, sometimes ambulance services are owned by a city or a county, so it's going to be a little bit more difficult from a bureaucratic standpoint or a legal standpoint to try and figure this out now. So they just decided to table the out-of-network billing issue when it came to ground ambulances, again, because they're mostly owned by cities and counties, and they're going to address that in the future. So for now, the ambulance service can still send you an out-of-network bill after the fact. They can still balance bill you, whether you have insurance in-network or out-of-network benefits. They can still send you a surprise bill, and you're either going to be on the hook for the whole thing, or you'll be on the hook for more of your cost sharing because your out-of-network benefits or have a higher deductible, higher coinsurance, all that good stuff. The thing that's a little frustrating about this is that doctors bill out of network because it gives them a little bit more higher reimbursement because it can help them cover their cost of running their practice. So now doctors in these situations, emergency situations, don't have that ability to bill out of network in an emergency situation, but the ambulance service is able to do that, so they can still get higher reimbursement. But in addition to that, something the doctors never had, the ambulance services, again, owned by the city and the county, and so they're getting tax revenue. So not only are they able to balance bill and get higher reimbursement, but they're also getting tax revenue. Again, doctors, no, we're never getting tax revenue. So a little unfair. Now, so that was what I was talking about, was for insurance situations, surprise bills, and emergency situations. Now, what happens if you're in a non-emergency situation? Can you not send a surprise bill? Well, the answer is yes and no. Let's say you're a woman going to the hospital, you're in-network hospital, you're getting your baby delivered by an in-network OBGYN, but the anesthesiologist that puts in your epidural is out of network. Well, in the past, that anesthesiologist could have sent you an out-of-network bill, and if you had out-of-network benefits, you would have higher cost sharing. If you had no out-of-network benefits, you're on the hook for the whole bill from the anesthesiologist. So now with the No Surprises Act, that anesthesiologist can no longer send you an out-of-network bill. They can only send you an in-network bill. What that in-network bill is, we'll talk about in a second. It's a little complicated. Essentially the idea here is, in a non-emergency situation, if you don't really have a choice of who the doctor is, like the anesthesiologist or the radiologist reading your x-ray, then you're not going to have to pay an out-of-network bill. You're not going to be able to get an out-of-network bill. Does that mean that nobody can bill out-of-network for a non-emergency situation? Well, that brings us to our first exception to the No Surprises Act. If you have a choice of doctors and the doctor is out of network, if they want to bill you out of network and you're accepting that, they have to give you a consent to sign saying that you accept that you are giving away your rights as far as the protections against the Surprise Billing Act. That if you're giving up those rights, you have to sign a consent form, which looks a little like this. This is what CMS, the Center for Medicare and Medicaid Services, has drawn up, this consent form that you have to get signed. It's the surprise billing protection form that basically says, I'm giving up my rights against my protections against surprise billing. I'm going to have to pay the out-of-network bill, and if I get a surprise bill, it's not technically going to be a surprise bill. They can balance bill me. So you have to sign this consent. That's the first thing. If you are a doctor providing a non-emergency service and the patient has a choice of the doctors, that's the first thing. They have to sign the consent. Second thing is, you have to give them an estimate of what their potential out-of-pocket costs are going to be. So that raises the hurdle a good bit, because before you would just say, oh, well, we're going to charge you and you'll get a bill, and whatever the bill is what it is. Now you have to give them an idea of what their potential out-of-pocket costs are going to be. So one of the things you can do is you can say, this is what I'm going to charge you, and then as far as how much the insurance is going to pay for, how much you're going to have to pay for it, if you even have out-of-network benefits, that's something they need to find out beforehand. And I'm going to talk about how you as the provider can help them with that information ahead of time. So you have to give them the consent, and you have to provide them with an estimate of what their potential out-of-pocket costs are going to be for your services. Now, there are exceptions to those exceptions. As I mentioned before, that if you are a doctor that the patient really doesn't have a choice of who they're getting, then you can't get the patient to sign a consent to bill them out of network. You're not allowed to provide them the consent, even if they're willing to sign the consent. So that means that if you're an ER doctor, you can't bill out of network under no situation. Anesthesiologists can't bill out of network under any situation. Neonatologists, radiologists, pathologists, things that you can imagine, you don't really have a choice. You don't have a choice of your pathologist or the person drawing your blood and like running the lab test. So those people can never ask you for consent to bill you out of network. They always have to bill in network. What that is, we'll get to in a second. The other situation where you can't get, and I kind of already alluded to this, if you don't have a choice. So if there's a particular breast reconstruction you want, and the only doctor that provides that type is out of network, if there's nobody in network that provides that same service, that out of network doctor is not technically allowed to bill you out of network. So you just have to hope that there's somebody within your region that provides that same service that is in network. So what is that in-network rate? If you can't bill out of network because it's an emergency situation, or you're the type of doctor that is not allowed to get consent, what is the amount that you're able to bill? Well, according to Congress, it was restricted to the in-network rate. And they said you can take in a few things into account. You can see, the median in-network rate. You can take into account how much you were paid before this bill, like as a provider, how much you were reimbursed before. You can take into account the complexity of the case. And so that was what Congress said. CMS then said, oh, we're going to just say it's the in-network rate. And so that was found to be not fair because that's allowing the insurance companies to put their finger on the scale. And so there were multiple lawsuits, the Texas Medical Association, AMA, multiple lawsuits saying that that's not fair, just saying it's the median in-network rate, because that's not what Congress said. Congress said that was one of the variables that could be factored into it. And the courts so far have found in favor of the Texas Medical Association lawsuit. So that's good news for providers that it's not just the median in-network rate. CMS is going to come up with some new regulations, and we'll have a better idea of what you can get paid for the median, for the in-network rate. Now, if the amount you get paid is not doesn't make you happy, then you can launch a dispute resolution of the provider against the insurance company. Both sides have to pay into it to the dispute resolution, and whoever wins gets their money back. And then just overall, if you violate the No Surprises Act and you send an out-of-network bill when you're not allowed to, then that's a $10,000 penalty. So that was reducing surprise bills when you are using insurance. Now, what if the patient's not using insurance? And this is going to apply to all of our cosmetic providers out there. That's where you come in with the good faith estimate. So that includes, you have to provide a good faith estimate for people that are uninsured, and that's for people who are choosing not to use their insurance. Now, in all the regulations, they always refer to people who are not using insurance, who are self-pay. It never says cosmetic, it never says aesthetic. So initially, myself included, plastic surgeons didn't think this applied to them because it just never really explicitly said aesthetic or cosmetic. It was uninsured and people choosing not to use their insurance. And even from the CMS regulations in this excerpt I'm showing you on the screen, it says that you have to provide a good faith estimate to people that are not enrolled in an insurance, uninsured, or they're choosing not to use their insurance. Well, that's people who are like going to get an MRI and they're choosing not to use their insurance because of the negotiated rate, or because they haven't met any of their deductible, that it's going to be like a $1,000 MRI, whereas if they just pay cash up front, it's $350. So those are people choosing not to use their insurance. That's who this bill was talking about. It's not talking about cosmetic patients because they're not choosing to use their insurance for their cosmetic procedure. They're not allowed to use their insurance for cosmetic procedure. The insurance policy excludes cosmetic procedures. So that's why the way this was written, it doesn't technically ever include aesthetics, but the problem is the way they use the terminology of self-pay, that's cosmetics, and that's how we've gotten swept into this. And I've talked to a lot of experts about this, and even though we might not like it, cosmetics is, as of now, is included as part of what the good faith estimate you have to provide to a patient for cosmetic procedures that involve, like, a surgery center and things like that. So when it comes to the good faith estimate, you have to provide the estimate within 1 business day. If the procedure is scheduled within 3 days, you have to provide it 3 business days, or within 3 business days if it's 10 days or more. But no matter what, you have to provide the good faith estimate upon request within 3 business days, whether it's sooner or later. You can't say, oh, I'll send it to you in a week. And then if the patient does get a bill after the fact that is more than $400 than what the good faith estimate said it was going to be, then they can launch a dispute against that provider. So notice the difference, and that's why I'm really emphasizing the differences between when you're using insurance and you're not using insurance. Because when you're using insurance, you have to provide an estimate for your services, and if you're not happy with the bill, the amount you get paid, the dispute resolution process when you're dealing with insurance, you're suing, your dispute is against the insurance company. When it's a good faith estimate, the dispute is between the patient and you, the provider. So that's why there is a difference there. So if you send a bill after the fact it's more than $400, they can launch a dispute as well, the consumer against you. So moving on, again, another way that this is different between the 2 types of estimates, whether you're using insurance or not. If it's out-of-network estimate, you have to provide the patient with an estimate that's got their name on it, the CPT code, cost for yourself, for your own services, the consent form that I showed you about the surprise bills, and then you have to list any other available in-network providers. There's also something called an advanced EOB that has not been implemented yet. There's too much technological plumbing that hadn't been built out yet. And an EOB is explanation of benefits that patients usually get after the procedure, showing that this provider, the doctor, the surgeon charged this much, the anesthesiologist charged this much, the hospital charged this much, you're having to pay this, the insurance company is paying the rest of it. That's what an explanation of benefits has typically been after the fact. Now they want to do it before the fact. So that's what an advanced EOB is that you would provide your cost for your services as the surgeon. You would send that to the insurance company. Then the insurance company, based on a lot of different factors, would then figure out how much the anesthesia cost is going to be, how much the hospital facility fee is going to be, or a lab test, and then they're going to send the patient that advanced EOB. That's not in place yet. So as of right now, if you're providing out-of-network benefits, the only thing you're responsible for is your own fee as the provider. Now, look at that in contrast to the good faith estimate. You have to provide all the costs, your fee, the anesthesia fee, the OR fee. You have to tell the patient all their costs if they're uninsured or they're not using insurance or they're self-pay, i.e. cosmetic. And that quote that you provide them, that good faith estimate, has to have the patient's name. It's got to have your tax ID number on it. Not sure why. Your NPI number, diagnosis code. There is a cosmetic diagnosis code, CPT code, if there is one, because if there's just not if it's a cosmetic procedure, there's no CPT code. Just leave that blank. And then you have to provide the cost, as I mentioned, for each provider, and you have to include that disclaimer about if you get a bill for more than $400 and what the good faith estimate showed, then you can launch a dispute. And then in that dispute, you can explain like, well, this was this additional cost because of something crazy happened that was unexpected. And then you'll be able to still charge that. It won't fall under a violation of the No Surprise Act as long as you explain why this was like an unexpected circumstance that you had to send a bigger bill. And then starting in 2023, you don't have to technically do it now, but in 2023, they are introducing the concept of a convening provider. And what that is the entity, the provider or the facility that provides the consumer who requests an estimate all of the included fees. Okay, so again, with the insurance, you only have to provide your fee. With the good faith estimate, you have to provide everybody's fee. And so the thing that's kind of funny about this is that, you know, we're already a convening provider if you're a plastic surgeon or a cosmetic surgeon that's doing surgery at an ASC or your own operating room. You're already providing the patient with your own fee, the OR fee, the anesthesia fee. So you're already a convening provider in some sense. And that's the ironic thing about all this is that, you know, plastic surgeons, cosmetic surgeons, aesthetic providers are thinking that this good faith estimate, the No Surprise Act doesn't apply to them, when in fact, we're actually the best position to comply with this because we're already acting like convening providers because whenever we have a procedure, we're already providing the patient with all of the estimated costs. So that's why when it comes time to decide who's the convening provider, if the hospital says, send us your fee schedule, we're going to be the convening provider, or the ASC says, send us your fee schedule, we're going to be the convening provider. I'm saying that it could be you and it should be you. The law leaves it kind of open-ended that it could be the ASC, it could be the doctor. Essentially, it's whoever the patient asks for the estimate, and that's usually going to be the doctor after the consultation. So that's why it's naturally going to fall to us. But I think it should be you because you're going to be you have the most skin in the game. You're going to be sure that the estimate you provide to the patient is the most accurate, certainly for your own fees, and you're going to get the OR and anesthesia fee schedule, and you'll provide that. Now, if after the fact the anesthesiologist sends the patient a surprise bill saying, oh, well, it went over, you owe us $600, the patient can file a dispute against the anesthesiologist. Just because you're the convening provider, you're not liable for everybody's estimate. If your estimate is wrong for yourself personally, then yes, they could just launch a dispute against you. But that's why it's important for the OR and anesthesia fee schedules to be accurate when they give them to you. So that's why we should be the convening provider, so we can be the master of our domain and kind of be in control of what's going on. It's like a little bit of a power trip that we probably all have to some extent. So that's the overview of the No Surprises Act. But this really requires a lot of things for your office to deal with on a daily basis. That's why I feel like there's no healthcare legislation that has had as much effect on us as providers, especially aesthetic providers, in my lifetime. I've never seen a bill like the Affordable Care Act didn't affect me as much as this is going to. This is going to affect you on a daily basis. And so you're going to have to be thinking about all these things I have to comply with now. Am I going to handle it in a manual way or try to find an automated way to deal with it? So I'm going to go through and just kind of show you each of these different touch points, the touch points of how the No Surprises Act touches our lives and affects our lives. And I'm going to show you some manual versus automated ways of addressing each one of these. So the first thing is people are going to be calling all the time asking about estimates. And I know people already call asking how much things cost over the phone right now. But now there are people on TikTok and Instagram talking about how you have a right to get a good faith estimate. Now, they're not talking about technically the good faith estimate that CMS requires you to give a patient after seeing them, but people are just going to think that they have the right to an estimate of some sort. So I think people are going to start calling more, asking how much things cost. And if you do the same thing that you've been doing, where you say, "Oh, well, we can't give you an estimate over the phone until we see you," or you just refuse to give them an estimate, or you give them a range that's not really helpful, then the patients are going to be upset if you basically don't give them an estimate. And they could potentially write a bad review saying that you're not compliant with the No Surprises Act. They wouldn't be accurate, but they could still write that review. They could complain to the medical board saying you're not providing good faith estimates. Again, them asking you for a price over the phone doesn't have to be technically a good faith estimate like CMS, the Center for Medicare and Medicaid Services, has codified, but they are going to expect some sort of a price point. So the way you can handle that manually is you can just email or reply to every patient or spend a bunch of time on the phone with them going over the estimate for them, which is going to be a huge waste of time. The other way to do it is to automate that process. And I was going to show you a quick video of how we do that in my office, that we automate and make the estimate process over the phone much easier when the patient calls. So this is the dashboard that my office staff uses in our office. And what it is that they have a list of all the different estimates we've gotten for patients we've provided in the past. And you'll see this big blue button on your left-hand side of your screen where it says start a new estimate. So somebody calls saying, "Hey, I want to know how much a breast dog cost," or whatever. And what the office staff does is they click on that button rather than going with these scripts and trying to explain everything of how, it's value and you shouldn't get the cheapest and all. We just get their email address and we get their name, and then we just give them a quick cosmetic estimate. So no scripts, no wasting time, not saying, "Oh, we got to see you in the consultation first." We just go through our list of procedures that are in our database and we pull up the procedures that they're asking for. They want a tummy tuck? No problem. We add it to the list. And then they might say, "Oh, I also want a neck lift." No problem. We'll add it to the list. This is all while we're on the phone, making this very quick and simple. And then we can even make it more accurate, because if it's a secondary procedure, we actually provide a discount on the secondary procedure, so we can update the estimate with that discount. And then we can email the patient while they're on the phone, send them that estimate of a breakdown of everything that is and as the convening provider, it's the surgeon's fee, the OR fee, the anesthesia fee. And we can email the patient while we're on the phone and send them a copy of that estimate right then and there. And then the answer has been given to them. They know now. And then you can ask them, "Hey, do you want to schedule a consult?" You haven't wasted all this time with beating around the bush, talking about, "Oh, it's a value proposition and this and that," and all these scripts that I've heard people give. We're making it quick and easy, giving the patient an estimate within 20 seconds of them calling. And we're getting their email address in return. So we're not just giving out the number over the phone, which I definitely don't recommend that. We're at least getting an estimate. I'm sorry, they're getting an estimate. We're getting an email address. We're getting a lead out of this. So even if they don't come in for a consult, we're still adding them to our email database. We're just passively growing our email database for every single person calling and asking for an estimate. Now, the other thing that you could do, instead of just handling all these phone calls, because we're probably going to be, you're already getting a lot of phone calls about estimates, you're probably going to get more calls about estimates. So an even easier way to do it is have the pricing patient facing. And so manually, you can just list a static menu of prices on your website. The problem with a static menu of prices is that you don't know who's looking at it. You're not generating any leads out of it the way I just did when people call. The other thing is, if you're providing any insurance information, that's going to be really hard to list all the insurance plans and then list all your procedures and then list all the negotiated rates associated with each of those insurance plans. And you're certainly not going to be able to give a patient an estimate of what their out-of-pocket cost is going to be. So what I suggest is automating this and shifting this all towards the patient. And so I'm taking a page out of the credit card company's playbook. What I mean by that is, back in the day, when you went to the drugstore or the convenience store or the grocery store or even the doctor's office, you had to give your credit card to the person on the other side of the counter to charge you, because they were so specially in service that only they could run the credit card. You weren't able to do that. But obviously the credit card companies have shifted that now, where they're letting the consumer do it. So we're putting in the credit card ourselves. We're going to get coffee or whatever. We're using Samsung Pay, Apple Pay. And so we're letting the consumer do that. So now, just in that same way, when patients want to know estimates, instead of making them have to all call the office asking about pricing, even though we can generate a lead in the process, we shift all that to the website and let the consumer check pricing now. And we do that in a couple ways, and I'll show you both of the ways now. This first example is with a chatbot. This is my website in San Francisco, Pacific Heights Plastic Surgery. And when the consumer wants to know price, they just open this chatbot and they choose a category. If it's insurance, they can choose the insurance plan. But they choose a category. Let's say they choose breast, and then they see all of the different breast procedures I offer. So enlargement and lift of breast with silicone implants. And then they have to put in their email address, and they put in their name, first name, last name. We choose to ask for this additional information, their phone number, their zip code, and we don't show them the price right there because we don't want them to put in a fake email address. So they automatically, after they enter that information into the chatbot, they immediately get an email that has our logo on it, has the patient's name, a breakdown of all the prices. The patient sees this, gets this email. Our office staff gets the same email, so we can see the patient's email address and phone number. We can see the zip code and things like that, where they came in, where they're from, if they're local, so that helps us know that, oh, that's somebody we should call back sooner. So every time a patient checks pricing on our website now, that we're getting a lead out of it, they're getting the answer to their question. We get their contact info so we can follow up with them and see if they want to come in for a consultation. Makes things a lot easier. It's even quicker than a phone call. So now the next touch point is, let's say that patient who just submitted that wish list for enlargement and lift of breast with silicone implants, let's say they come in. Well, they come in for the consultation, and if you're doing this manually, then what you're probably going to do is you're going to do what you do all the time is doctor sees the patient, they update what they need, or they kind of have that discussion with, well, you're not really a candidate for this, you're a candidate for that. That happens all the time. But then the thing is, if you're going with the manual route, you're going to have to draw up a new quote, whether you use Microsoft Word or Microsoft Excel. You have to draw up a quote that's not necessarily going to be No Surprises Act compliant. So in an automated way, this is how we handle it at our office. Same dashboard where that we were able to start a new estimate before, but in this example, we are able to see all the estimates that are coming in from our website. And so that person who submitted that enlargement and lift of breast, we can see their specific estimate and we can go in and edit it. Let's say they came in for the consultation and maybe that's not the right procedure, but we update it. And then we can switch this to a good faith estimate. So instead of just getting their email address and phone number when they call, we switch this to a good faith estimate that has all the requirements that are required for the good faith estimate, including their address and the diagnosis code. And if that was the right procedure, then we just update that estimate for them, and we print out a quote for them that's got our logo, it's branded and everything, it's got all the important information like the diagnosis code for a cosmetic procedure. CPT code's not available, but it's a breakdown of all the pricing, and it's got that disclaimer that CMS requires you to provide the patient so that they can see their cost, and they know that if it's more than $400, they can launch a dispute against that provider, and they sign it. So the patients are already signing the quote. Now they're just signing a quote based on an estimate that they created, and you didn't have to start from scratch when they came in. And the quote also includes that disclaimer that CMS says you have to have. So it's all really nice packed into one little package here so that it makes it much easier, more efficient for your office staff when that patient finally comes in. So the other example I want to talk about is when it comes to being a convening provider. So right now, if you go to multiple surgery centers, you have one operating room in your office, but you have to go to other places. Well, as a convening provider, when the patient comes in, you have to go through all your spreadsheets of OR and anesthesia fees and say, okay, the doctor's doing this procedure at this office, so that or that facility, so that's what these OR and anesthesia fees are. Oh, they're doing this procedure at this facility closer to where the patient wants, so it's a different OR and anesthesia fee. So you're looking at all these spreadsheets that you already have, and there's obviously a risk of putting in the wrong pricing information, and so the patient gets a surprise bill, and they're pretty upset about that because you gave them the wrong estimate of the OR and anesthesia fee schedules. So what we've done is we've actually made it so that you can incorporate that all into your system. So when the patient comes in, if we're creating an estimate for them, we automatically pull in whatever the OR and anesthesia fees, assuming they're based on time, and we can apply it specifically to that facility. So for the office, they can have all those OR fees set up there, or if it's at a surgery center, you'll notice as a toggle between these two, the OR and the anesthesia fee schedule change between the two because they have two different fee schedules. And so our system will allow you to incorporate that estimate so that you're getting the right amount, you're getting the right fee for them, so that whenever you give them that bill, it incorporates the correct fee associated with that particular surgery center, so you're not making any mistakes. The other thing is that if you are providing any insurance out-of-network benefits, you can manually, you're going to have to call the insurance company to find out how much that patient's going to owe out of pocket, or, what they paid already and what they're going to now owe after they've done their out-of-pocket maximum, their co-insurance, their deductible, or if they have out-of-network benefits or not. The calculations vary. So you could do that manually by calling the insurance company, which a lot of you probably are doing right now, or you can automate this also with real-time eligibility verification. So this is what we do on our website, that the consumer can check their insurance-based pricing for that insurance-based service. So I know that there's some people here, I know a lot of you are doing cosmetics, but you probably are associated with the clinic, that there may still be some insurance involved. So here the consumer can come to our website and they can scroll through all the different insurance plans that we work with, or that we're in network with, or out of network with. And in this example, the consumer will choose United PPO. Then they'll go through all the different categories. This is all part of our price estimator that sits on our website. It's a little bit more fully functional than the chatbot. And in this example, the patient chose DIAP breast reconstruction. And if they know their deductible and out-of-pocket maximum and their coinsurance, they can enter it in here, but they probably don't know that. But at the very least, they have their member ID number. They have their insurance card in their wallet. And so they put in the member ID number, they put in their first name, last name, date of birth. We still get their contact information because we're still generating a lead. And so they are able to see not only what your negotiated rate is, or whatever your rate is if you're out of network, they can also see how much they've paid towards their deductible, their out-of-pocket maximum, their coinsurance, and then they see what their out-of-pocket expense is going to be and how much the insurance is going to pay for it. In addition to seeing it here on the screen after we verified who they are, they also get an email just like before where they get a breakdown of all the pricing of the coinsurance and all that good stuff and their out-of-pocket cost. And our office staff gets the same email with their email address and phone number, so we can follow up with them now. So this is really beneficial for multiple reasons. One is the patient is getting pricing information ahead of time. They're doing the real-time verification on their own, so your back office staff doesn't have to call the insurance company and wait on hold to find out how much they paid towards their deductible and all that good stuff. So that's one benefit. The patient's doing the heavy work for the back office staff. The second benefit is that now the patient sees that, oh, I actually owe something out of pocket, because patients who have insurance, they don't think they owe anything. And when they come in and they have to pay a $40 copay just to see the doctor, they're irate. Like, why do I have to pay $40? I've got insurance. So if you think they're upset about the $40, they're really going to be upset the fact that they have to pay out of pocket $8,300 for this procedure. So now you're letting them know that ahead of time, so they come in for with more realistic expectations. That's the second benefit. Third benefit is when they come in, they see the doctor, and that's the procedure they need. Then when they go to the office manager, the billing person, to talk about how much they owe, now they're less likely to yell at the billing person or the office manager, whoever's handling the requirement to, or whoever's asking them for the money. So it just gives a more realistic understanding, and it offloads a lot of the stress off your back office staff. So one of the big benefits. Now the thing is, just like before, let's say that patient submits that estimate, they come in for that procedure, and then we can do the same thing. My office staff can pull up that estimate that they already submitted on the website, and then we can edit it as needed. We can switch them to the, if that was in network, we can switch them to out of network or vice versa. And then we can also fill in all those requirements for the No Surprises Act, including the address and the patient's date of birth, how they want to be contacted. We can choose the diagnosis code for this breast reconstruction procedure, so it happens to be malignant neoplasm of the breast. And let's say the patient isn't a candidate for that breast reconstruction. And this, of course, works for cosmetic procedures. Let's say they're not a candidate for that particular procedure. Well, then you can go through, we can go through our database and choose the correct procedure, subtract out the wrong procedure, and explain to them why we're having to switch procedures, which we always have to educate the patient eventually if they have unreasonable expectations. The benefit for this, though, with insurance is that we already have all their insurance information, and we can rerun that real-time eligibility and then find out what their deductible is, how much they've paid in the past for their deductible, their out-of-pocket maximum as far as out-of-network benefits, what their coinsurance is, all that good stuff. We can recalculate that because we have all their insurance information, and then we can create that estimate for them that is No Surprises Act compliant. It's got all the demographic information, it's got the diagnosis code, it's got the CPT code in this case because there is one, and it's got a breakdown of all the pricing, and then it's got that surprise billing protection form that I showed you earlier that basically says you're giving up your rights to surprise bills, you're agreeing to get a higher out-of-network bill, potential balance billing if insurance doesn't pay for the rest of it. And they sign this form just like they would sign the quote anyway, and now they've signed the No Surprises Act consent form, and you're compliant with the No Surprises Act. So much more efficient way of handling this, because this is going to affect you on a daily basis. So what we've done is we've allowed the patients to get an online estimate to totally revamp your office workflow, but in a good way. The patient's now getting the estimate, not necessarily having to call the office for everything. They come in for the consultation, we confirm the procedure's right, we give them that quote that they submitted already, or we adjust that quote if it isn't right, and we explain to them why it's different, which is all part of every consultation. And then we create an estimate for them that is compliant with the No Surprises Act, whether it's the out-of-network estimate, that's just for your provider's fee, or the good faith estimate, which includes everybody's fee for you as the convening provider. So these are some benefits. These are benefits of price transparency, because I know not everybody's thrilled about price transparency, but it will give you a competitive edge. And one of the things we also found is that we did a study where we submitted this peer-reviewed journal, got published, and we found that when patients come in that are price aware, they're 41% more likely to book a procedure than non-price aware patients. So ostensibly, that's because they're not experiencing sticker shock. So it's going to convert more patients from the exam room to the OR, to the procedure room or the operating room, and wasting less time on consultations that are futile, that go nowhere, and maybe you did the consult for free and it's super frustrating. These patients can have a better idea of how much things cost before they come in, and it's not unreasonable, and that's what they're going to expect with each passing day. The other benefit of price transparency is that with our database of pricing, with all of our providers that use this platform, we can now show you how your prices compare. So for breast augmentation with silicone implants, and again, this is just for the provider and the office staff to see. This is not for the patient to see. If the patient wants a price, they can submit a wish list for that procedure from that doctor. But we have access to see how all the prices compare in the back end. So for breast aug with silicone implants, you can see how your prices compare to all of our other providers in our network, all the way down to the level of the zip code if the information is available. Same thing with non-surgical treatments, and same thing with minimally invasive procedures, where you can see how you compare to our other providers for the same procedure across the US, region, state, 50-mile radius, and zip code. So all of these resources I was talking about, you can email me at jonathan@buildmybod.com to get those. I'll be happy to forward those to you. And one of the other things you can do if you want to read more about it, this is the article I published in Newsweek with U.S. Senator Bill Cassidy, talking about the No Surprises Act and how there's so much price transparency in there, which is good for the consumer, and we can use that to our benefit, because I really want you to see this as the glass is half full, not half empty. Use this legislation as an opportunity to improve your workflow in your office by shifting more responsibility to the patient, letting them check the estimates, which it's clear in the emails they get that it's just an estimate. And then that'll reduce your workload on your back office staff if they're dealing with having to answer questions about pricing, or if they're having to call the insurance company to get the information about the out-of-network benefits. It reduces burnout, and it just takes the existing tasks you're already doing and just making them more efficient. So thank you so much for your time. Please don't leave. We got a whole nother hour for you. Audrey's going to talk, and she always gives an awesome presentation. But feel free to follow me on Instagram or on LinkedIn. Follow me or Patient Now on LinkedIn. And again, you have my email address to reach out to me with any questions. If you want an account with use our platform, you can log in and create an account at buildmybod.com/providers. And we have a special promo code using Patient Now. We came up with every variation of Patient Now, either as one word, two words, caps, lowercase, all that. So the promo code should work, and you get a discount on a 10% discount on an annual subscription. So Audrey, I'm happy to answer questions now, or we can wait till the very end after you're done. You just let me know. And either way, people can email us.
Yeah, first and foremost, thank you so much once again for educating everyone on the No Surprises Act. So we did have one question roll in, but I'm going to give a couple more minutes for those attendees on to type in your questions for Dr. Kaplan as it relates to anything and everything that he just discussed over the last 45 minutes. So I'll give another minute for some attendees to type in their questions. But in the meantime, the first question that we had was, does this apply to medical spa services?
So it does to some extent. So I know that if you're not going and doing a procedure at a facility, that you don't have to provide a good faith estimate in that situation. But the thing is that's tricky about this is that if you're doing Botox, you probably don't really need to provide a good faith estimate for Botox. It's like it's one and done. The thing is, it's when you start to do laser hair removal and you don't tell the patient about the potential for the, that you have to come back once a month for 6 months, or that there's these touch-up potentials. The thing is, you're going to have to give a good faith estimate for those things that are not just one and done. If this is a prolonged treatment plan, whether it's cellulase or Selfina or any kind of minimally invasive procedure, that even if you're not going to another surgery center or laser hair removal or IPL, something that you're doing on a repeated basis, you're going to have to give these people a good faith estimate, because their fees are going to continue, and you can't let them say, oh, I didn't know about these fees ahead of time. So again, if it's Botox, if it's Juvederm, yeah, probably not. But if it's a package deal where they're going to be coming back and getting more things, I don't see how you can get away from providing a good faith estimate, because they're paying out of pocket, they're self-pay. And so yes, I think that this applies to med spas to some extent.
Got it. Looks like we have a quiet audience today. I'll give another minute and we'll see.
Well, the other question I always get is if and I talked about a little bit, that if you're the convening provider and you're providing all these fees, what if, if your fee is okay, but the anesthesiologist fee is, they send a bill after the fact, that you're not liable as a convening provider, that the anesthesiologist could have a dispute launched against them if they send a surprise bill, which is just all the more reason for the OR and anesthesia community to provide you with good estimates ahead of time. And the other thing people ask is like, well, what if the tummy tuck goes longer? Well, what I would recommend is provide an estimate that overestimates, a good faith estimate that overestimates what the cost could be. So in case, if you think that tummy tuck's probably going to be 2 hours, but it could be 3 hours, then provide the estimate for 3 hours. And then if it isn't 2 hours, then great, no problem. But if it isn't 3 hours and you didn't collect all the money up front for the 3-hour version, then you can send them a bill after the fact saying, okay, well, it went over to the 3rd hour, you owe me this. And even if it's over $400, you're okay because you told them that ahead of time. So this isn't saying that you can't send a bill after the fact. It just can't be a surprise bill. And so by using price transparency to provide that pricing information ahead of time, you're going to be able to be in the clear if you send them a bill after the fact that was consistent with the good faith estimate, even if they might feel like it was a surprise. They didn't think they were going to get charged anymore. But if you told them that ahead of time, you're in good shape.
Got it. Let's see. No more questions. Were there any other last pieces of advice you had?
No. Just reach out to me if you have any questions. Email me. But the other thing is, reach out to me at the very least to get those notices that you have to put on your website and you have to put by your front desk. So, and like regards to the med spa question, doesn't matter if you're a nurse practitioner or a doctor or a med spa or a fully functional, fully encompassing clinic, with an operating room and everything like that, that no matter who you are, if you're scheduling patients and your patients are paying bills, you have to have those 2 notices up by the front desk. So there you go. That would be my last bit of advice.
Awesome. Well, thank you guys for sticking around. As Dr. Kaplan mentioned, we're going to continue on. And I highly encourage everyone to reach out to Dr. Kaplan. Take a look at his BuildMyHealth platform. It's a great piece of technology to not only assist with lead gen, but also assist and prevent your practice from getting in trouble with a lot of these things that he just touched on. And it's a great thing as it relates to building your email database, which we both stress a lot. Definitely a powerful thing for your practice.
I think that's like a perfect segue for you. I'm sure you're going to talk about email marketing.
So I'll definitely be touching on, the critical importance, as I know you would agree with as well, Dr. Kaplan, of getting that primary valid contact info. So you and I definitely agree on that front. All righty. So I'm going to quickly move my screen over for those of you who are going to stick around. This will be recorded as well. So if anyone needs to jump, it is a-okay. We will send out a recording tomorrow post webinar, and it will have the full length recording for everyone to watch. Okay, perfect. And then I want to do a quick A/B check just to make sure everyone can see me, hear me clearly, and if you can see my webcam as well. If you can just type yes in the question chat box on the right-hand side of that webinar dashboard, we will get ready. Okay, perfect. All righty. So we should be good to go. So, all right, everyone, once again, thank you guys so much for investing 2 hours of your Friday. Hopefully everyone had a very productive, busy week. Hopefully business in all of your practices is booming right now. There's certainly a lot of exciting things going on in the medical aesthetic industry, and we'll kind of go over some recent market data as well before we do jump in. Once again, my name is Audrey Neff. I'm the Director of Marketing for PatientNow RX Marketing and RX Photo. And as I mentioned at the beginning of the webinar, this was a course I did for Suniva Medical last month. We had great feedback, so I figured it was a great time to kind of redo the course for those of you who maybe did not attend the one last month. So over the next 45 minutes or so, we're going to be talking about maximizing your marketing dollars, primarily as it relates to lead conversion. And this is a very critical topic. You cannot have marketing success without converting leads into loyal paying patients at the end of the day. However, I think something that's a lot of pushback and things I hear in the industry, or even just questions around, you know, how do I get more leads? How do I get more leads? How do I get more leads? When a lot of times we actually need to take a step back and figure out, well, what are we doing in terms of our actual lead conversion? Because if we're, you know, driving all of these leads with our marketing dollars, our marketing efforts, budget, investment, time, energy into our practice, but then we actually have broken processes, broken training, broken tools, things like that. We're not utilizing the right technology. We don't have button up phone scripts in the process. How are we answering the phone? Are we gathering primary contact information? Are we following up with patient leads who reach out to us? If we don't have all of those things tightened up, it's going to have a negative impact on our marketing return on investment, right? So you can do everything right on the marketing side of things. So you can spend the amount of money that you need to be spending on the platforms that you need to be spending it on. But if you don't have the right processes in place to actually convert those leads into paying patients, which is ultimately really the only thing that matters at the end of the day, and obviously retention as well and patient loyalty, then really what's the point of your marketing in the first place? So this is what we're going to kind of touch on today over the next 45 minutes. So really quickly, the current state of medical aesthetics today. So according to the Aesthetic Industry Association's most recent 5-year forecast, it's showing the industry growing right now at 17% compound annual growth rate, which is great, so double-digit growth. Worldwide sales of dermal filler, for example, is also expected to increase about 16% to over $5 billion in 2025, and non-invasive procedures actually led the aesthetic medicine market share with over 50% share back in 2020, and this is expected to show notable growth through 2028. And actually, coming out of the 2021 year, the industry actually had a record year. Annual sales was around 15.6 or 7 billion. So, you know, the industry contracted a little bit back in 2020, which was of course to be expected. But the good news is we are on the rise, and there are very exciting things going on as it relates to consumer demand. A lot of private equity money is coming into this industry. We are seeing more practices open up. It's certainly becoming more of a competitive and commoditized market, which is why making sure that you have the right processes in place to maximize your marketing return on investment is going to play such a critical role in the future success of your practice, not only this year in 2022, but beyond 2022 as well. So let's set the stage really quickly. Of course, aesthetic medicine is elective, right? Meaning that the modern aesthetic consumer has a choice. You know, they have a choice to go to you for their surgical treatment or their injectables or their cool sculpting, whatever it may be. You know, they have a choice to go to the practice down the road, another provider in their local market. And a lot of times, if we're talking about millennials, let's say, which is, you know, one of the most valuable demographics right now in this industry, given that they do have full purchasing power and their market share is the only demographic that actually has market share expected to increase, not decrease, unlike Gen X and boomers, their market share is decreasing. As it relates to millennials, you know, if it's a younger millennial, a lot of times you may be competing with other things besides practices and providers in your local market. It might be a decision between, do I want to spend this money on maybe a vacation, on my student loans, on something else that costs money? Because when it comes to medical aesthetics, while I am a big candidate for yes, it is essential in many ways when it comes to mental, physical, overall confidence and things like that truly affect someone's life. You know, there's no doubt medical aesthetics changes someone's life for the good, but a lot of times we also need to keep in mind that they don't necessarily need treatment XYZ, right? It's a desire, it's something that they're looking to solve some type of problem for, usually aesthetically. somewhere on their body. So just something for us all to keep in mind is that we are competing with not just providers, but we're competing with other things that cost money as well. It is certainly becoming more crowded, commoditized, competitive. Does not mean that the market is saturated, I would say. And I hear this all the time, people talking about the market is so saturated, the market is so saturated. Well, yes, I agree. Some local markets are going to be more saturated with practices. For instance, Beverly Hills, Miami, Florida, wherever it may be, Orlando, Florida, I could literally, which is where I'm based, I could literally throw a rock and hit a med spa, right? There's 5 at every corner. But market saturation comes when there are too many providers than the amount of consumer demand. And we actually have the opposite right now happening in this industry. So there's actually not enough qualified providers to meet the overall national consumer demand that we are seeing, which is great for all of us. It certainly creates a very unique opportunity for growth. And then the big question is, how are we going to capitalize on this very unique opportunity for growth? An underpenetrated market, even with facial injectables, the market penetration is still under 10%. So lots of room for growth there. And the millennial demographic is no doubt feeding market growth. For those of you who do know me, you know that my most passionate topic to speak about is anything as it relates to marketing and retaining millennial patients. So I do a course on that every single quarter. I believe we'll be doing one next month. I'm sorry, not next month, in June with Suniva Medical. So we're not going to spend time on this slide because it's somewhat of a complex slide and a lot of text, and I don't like a lot of text. But really quickly, we're going to park on it for a second. So at the end of the day, there's really only 3 things you need to do to build a thriving and sustainable business. And when we talk about the modern marketing and sales ecosystem in aesthetic medicine, these are the 3 things and 3 buckets that we kind of break everything into. So you have attract, convert, and retain. So attract would fall into increasing the quality and quantity of potential patient opportunities into your practice, right? We need to utilize our marketing investment, our marketing strategy, our budget to get people to reach out to us and inquire about a treatment or a procedure, right? Then we need to convert them. This is where the most amount of money is typically lost, which is what we're going to focus on today, is that conversion stage. Of course, we need to treat them, which, Dr. Kaplan can speak to this, providing that world-class patient experience, treating that patient, building that relationship. I think we would all agree that medical aesthetics is a relationship-driven industry. We want to build those connections with our patients, make them a part of our practices family to ensure that they keep spending money with us and that we retain them for, their lifetime value of being a patient with us. And lifetime value can be, tens of thousands of dollars over a 5-10 year time span. So just some things to keep in mind. And then of course, retention. So how are we going to keep them in our practices ecosystem? So before we jump in, what actually is the most important part of a successful marketing strategy to improve practice performance and profitability? It's conversion. So in marketing, truly, it's a very simple concept. While there's a lot of things that go into it, and there's a lot of things you need to measure and manage and track. When it comes to marketing, the only thing that matters is conversion. And marketing is truly, I would say, a series of cascading conversions as well. So the first conversion would be you need to show up online when a patient is researching, because the majority of patients, potential patients, are going to go to social media or Google to start researching aesthetic treatments and providers, right? So the first conversion would be you need to show up, right? And then from there, if they eventually end up on your practice's website, you need to convert them into an inquiry and gather their contact info as well. And then from there, you obviously bring them in for a consult. Then you have another conversion. You need to convert that consult into a booked treatment. The patient needs to show up, you do the treatment, you get paid, and then ultimately you keep them in your practice's ecosystem, because it is expensive when we talk about patient acquisition. And it's a lot cheaper when we talk about patient retention versus acquisition, which is why retention is very critical as well. And what drives conversion is, of course, going to be you. So as I mentioned earlier, you can do everything right on the marketing side of things. You can spend the right amount of money on the right amount of outlets, doing what ideally would be best for your ideal patient market. But if you don't have these 5 things tightened up, you're going to have problems, right? So it's going to be your leadership, the way you lead and manage your people, your priorities. So what are the business goals of your marketing? We always need to have goals. And then within those, you need to have micro goals on how you're going to achieve your end goal, of course. Your people, so your staff, their processes, and then the tools and the technology that you choose to use. And technology is something we all need to be utilizing in our practices, because unlike spreadsheets and things like that, technology is scalable, right? And so if we're in that growth phase and we're now looking to scale our practice, we no doubt need to have the right technology in place to not only assist our practice, but it will save a lot of our team members manual things that they don't have to do every day, which in return will, create efficiency in our business. And when you have efficiency in your business, you are no doubt going to be more profitable, right? So efficiency certainly equals profitability. So here are the 5 things we're going to unpack today. So the first is recording your phone calls and implementing talk tracks for overcoming objections. Of course, very, very critical. Following up with patient leads who do not book. And we have 2 tactics we'll unpack today. I call them brain and brawn tactics. So we will go over those. Tracking your patient leads and KPIs, so your key performance indicators, on a regular basis, and selling experiences and results, not products and treatments. And I talk to people about this a lot, actually. And this is a very hot topic, so I'm glad that we're going to cover it again today. And then cultivating your brand and your unique selling proposition. You cannot be marketing your business and not have a USP. And we'll go over some ideas on how you can create a USP. And I also have an exercise that I'll talk about later on. If anyone wants it, I'm more than happy to send it over to you. So as it relates to modern aesthetic patients, right, there's a lot of clutter online. There's a lot of things that we need to be doing. I also want to add that having a multi-channel marketing strategy is going to be the most effective with dealing with, I would say, like the psychology of today's modern aesthetic consumer and how they research online. So you cannot be putting all of your eggs in one marketing basket. So what I mean by that is you can't be just doing social media and then not do anything else, not pay attention to your website or not have a website, not pay attention to your Google rankings, not gather contact info to build that strong email contact database, right? You need to be doing all of these things in sync with one another, and that's when you're going to see the best results with your marketing. So email marketing, of course, your search engine optimization, and we're not going to take a deep dive into the marketing tactics today. We're mainly going to focus on lead conversion, but I do a ton of webinars if we want to get more granular on the marketing topics every single quarter as well. Social media, and of course, your website. So you need to be doing all of these things. And then ultimately, regardless of whatever marketing initiative that brings someone in, so whether they clicked on an email blast, whether they are on your social profile, they're on Instagram and they click the link in your bio to go to your practice's website, whether they found your listing on Google, they click on your listing, they're now on your site. Now they're either going to do one of 2 things, right? They're either going to fill out an online form on your practice's website, which everyone needs to have online contact forms on every single page, not just the home page. And I still see this a lot. Make sure that you have contact forms on every single interior page of your website. You can also incorporate, of course, powerful tools such as Dr. Kaplan's platform as well, BuildMyHealth, to get that contact information and that interest, that specific treatment interest of that potential patient opportunity who could be worth a lot of money. Or they're going to call you, and we'll talk about some phone tactics as well. So recording and listening to your phone calls first. So, and I travel a lot. I do a lot of presentations and things like that. And I ask this question all the time. And the question is, okay, out of everyone who's on today's webinar, let's say, how many of you guys, if you are someone responsible for growth in your practice, so whether you're the owner, the practice manager, whatever your role is, if you are responsible for the growth and success and hitting those revenue goals in the practice, first of all, I always like to ask this is, are you listening to what your people are saying over the phone? And very few people and owners raise their hand when I ask this question. And it kind of surprises me because unless you do have tightened up bulletproof phone scripts, everyone is trained on describing the features the benefits of all of your treatments and procedures, if everyone is trained on overcoming price objections over the phone and things like that, that's a different story if you guys already have all of those things tightened up. But for those of you who don't, and you don't have an actual phone process in place that is documented and everyone understands what that phone process looks like, you're going to be losing money over the phone. So I think a great practicing and training tool to do with your staff, if you're not already doing this, is make sure that you have call tracking metrics. So you need some type of call tracking software to capture and record your inbound phone calls. We'll talk about some CRM software that you can use later on, which is our software, but there's other platforms out there that you can use. So utilize call tracking to listen to what your staff is saying over the phone. Maybe you hold a meeting with your staff like once every other week, maybe it's bi-weekly meetings, sit down and just start going through some of the phone calls, because I promise you will learn so much about your business just from that one simple tool alone. And I mystery shop practices all the time, pretending to be a potential patient opportunity, interested in something simple like toxin or filler. And you will not believe the horrendous things that happen over the phone. A lot of times I'm not even asked for my contact information. I would actually say over 80% of the time, which is alarming, because if you're not gathering contact information, how are you going to follow up with that patient, right? So what is your staff saying over the phone? Should it matter who answers the phone? And this is another question I ask a lot is, okay, you know, how many of you guys think that it should matter who answers the phone? And normally everyone's hand shoots up. They think, oh, it should matter who answers the phone. And I actually disagree with that. I actually think it should not matter who answers the phone. And the reason behind that is because everyone should be saying and doing the same thing at the end of the day, period. Because if you have one person answering the phone going, hello, it's a beautiful day at Dr. Kaplan Plastic Surgery. This is Audrey, how can I help you? And then you have another person answering the phone going, hi, doctor's office, or hi, can you please hold? And they just sound like they're so miserable or whatever it may be. That's not the same experience, right? So we need to have a script for how we're going to answer the phones. So treatment scripts, this would entail having, and these are things that you can just create in the practice, and you know, with features of the treatments, benefits of the treatments, downtime of the treatments, who is a good candidate for the treatment, your unique approach to the application of that treatment. You can create some simple one-pagers for all of your treatments and procedures, and maybe just have them, you know, I think having them printed out probably isn't ideal, because then you're going to be shuffling through papers, but people need to be trained on those things. And I would also add, it could be valuable just to have them on some type of desktop on the computer, and when they're on the phone with a potential patient opportunity who is interested in sculpture or whatever it may be, they can click the sculpture file. They have all that information in front of them to effectively articulate and answer all of the questions that that potential patient opportunity may have while over the phone, and ultimately get them to schedule that consultation, right? So we need to have bulletproof talk tracks. How are we answering the phone? Once we create this sales script, we only want to change it based on facts, not feelings. So if we find something is not working, we can change it. But what we don't want to do is say, oh, I feel like this is working, or I feel like my staff is actually great on the phone. I don't even listen to phone calls, but I feel like they're really good. Totally different than facts versus feelings, right? Marketing is about data. It is about facts, data, and it's not about, oh, I feel like my marketing is working. That's not an answer, because that's not what's going to drive profitability at the end of the day, and ROI with your marketing efforts. Next up, we have following up with patient leads who do not book. We'll talk about in terms of brain and brawn tactics. So, and given that you guys already kind of listened to Dr. Kaplan's presentation, he did touch on this briefly, even though he was talking about the No Surprises Act, but this part did come out, which is if you could gather, you know, some pieces of information from a potential patient opportunity, what would it be, you guys? It's contact information. So making sure whether they are filling out a form, whether they are calling your practice, you need to have a process in place for gathering their primary valid email address and mobile number, because follow-up, there is so much money lost in the follow-up, right? So not following up with a patient lead can cost you money. It can cost you a lot of money. And if you continually do the same thing and you continually don't follow up with patients, I don't even know how much money that could cost your practice, right? If you're not following up with at least 3 patients that reach out to you every single day, or even just 1 patient, that's going to add up for a lot of revenue that is costing, or a lot of revenue that you are losing in the practice, right? So a patient lead, a couple of stats here, a patient lead is 7 times more likely to convert into a consult if you follow up within 1 hour. I would advise you reach out as soon as possible. I personally think an hour is too long, and then unless of course it's, you know, at 2 a.m. on a Saturday and someone filled out an online form. Of course, realistically, we wouldn't expect someone to call us at 2 a.m. Additionally, if you follow up within 5 minutes, you're 9 times more likely to convert them. And the reason that this is important is because today's modern elective medical consumer, they typically research multiple providers, especially when we start talking about the millennials. So if they reach out to you, you didn't answer the phone, or they filled out an online form, submitted it, and Susie is on a lunch break and gets back to her desk, you know, things are happening at the practice. She's checking some people in, checking some people out. Maybe she's on her phone doing some things that she shouldn't be doing, you know, rolling on Instagram or whatever, not really paying attention to that patient lead. Oh, I'll just call them tomorrow. And she calls them tomorrow. Well, that entire time span that she didn't follow up with them the earlier day, that potential patient opportunity could have called another 2 providers. One of those providers already reached back out to the person, scheduled that consultation, and that patient might have already been in the consultation the next day when Susie finally feels like she's going to reach back out to the lead who filled out a form the day prior, right? And if that person chooses to go to that provider, that's money that you lost, right? And I would also add that when we talk about profit leaks and things like that with your marketing and not following up, that other provider that the potential patient may have chosen because maybe they got contact info or they followed up as soon as possible, that provider may have been a worse surgeon, a worse injector, a worse practice provider than your practice. But since they handled that phone call better, or because they reached out sooner than the other practice, you just lost that opportunity that could have been worth $15,000. And they chose to go to that practice instead, all because you had someone that was, you know, not trained or not motivated, or you didn't have the right processes in place in terms of follow-up and things like that. And that cost you, let's say, $15,000. And even if it's, let's say, even if it's not a surgical treatment, maybe it was just a Botox patient, okay? Botox, as we all know, profit margins aren't the best. It's not going to be your most profitable treatment opportunity, right? But a first-time Botox user, if you do a great job in that consultation of, you know, creating a comprehensive 6 to 12 month treatment plan, or introducing them to your practice's unique membership program and things like this to bring up, you know, other things that they should be doing to actually achieve whatever their skin goals are. It's not just going to take Botox. It's typically a lot of times going to take some filler, some laser, perhaps some Sculptra, of course, medical grade skincare, monthly microdermabrasion treatments, whatever it may be. Creating that treatment plan and then having them stay consistent with that treatment plan. Honestly, a lifetime value, I would say, of, you know, a patient opportunity doing the bare minimum, if we're talking about toxin, filler, monthly facials, and some skincare. I mean, that 7-year time span can be about that 7-year time span can be about $45,000 to $50,000. And I've done the math on that. So I believe we actually have a little case study at the end of this presentation. So that phone call or that lack of follow-up didn't cost your practice $600 of Botox injections. It cost your practice $45,000 to $50,000, right? So we need to look at lifetime value, not first-time value. Additionally, it can take up to 8 touches to convert a lead into a consult appointment. So this is why it's very critical to continually follow up with patients. Now, we don't want to be blowing up their phones 5 times a day, every single day. That's a little too aggressive, of course. But we do want to be mindful about it. We want to reach out as soon as possible, reach out the next day, on day 5, again on day 7, again on day 10, whatever that may look like. And then in addition to reaching out to them manually over the phone, we need to be utilizing technology to assist with this follow-up process as well in terms of automation, because that will save our staff a lot of time. And then of course, we need to gather contact info to build up our email database. Your email database is truly one of the most powerful things that you can have in the practice. And when it comes to email marketing, how much money does that really cost you at the end of the day? If you have potential patient opportunities, contact information in a CRM database or any database, how much money does it cost to go in your CRM tool, build up an email campaign and send it out? $0. I mean, it costs you some time. I would say your time is worth money, of course, but in terms of, additional ad spend or marketing spend, it doesn't cost your practice anything. And when you have someone's contact information, that obviously means that they reached out to you and expressed interest at some point in time, so they are naturally lower hanging fruit. And your existing patients who have already gotten treated from you are even lower hanging fruit, right? So they are more likely to take that bite at the apple. So make sure that you are utilizing a CRM tool to gather information over the phone, put it into that CRM tool so you can blast out emails, whether it's promotionally, doesn't need to be discounts, things like that, just exciting things going on in the practice, and using it to automate your follow-up communication, which should no doubt be done via email and text as well. So here we have brain and brawn. So these are the two tactics for following up with patient leads. So first we have brain, which is automation. So this would be automated follow-up communication with CRM software through email and text to keep the patient leads top of mind. So once again, if someone filled out a form, let's say on Saturday night at 2 a.m., are we going to get some type of message out to them, letting them know that we received their inquiry? We cannot wait to speak to them, thanking them for reaching out, maybe with a little blurb around your practice's unique approach to aesthetic medicine and achieving natural results for your patients, whatever it may be, using that by email and text, just to make sure that they know that they are top of mind, and then of course manually reaching out to that patient as soon as possible as well. And then next we have brawn, which would be, so brawn tactics are going to be more difficult, I would say, than brain tactics, because brain tactics, once you do it, it's kind of like set it and forget it. So once you set up an email drip campaign, or you set up some automated follow-up campaigns in your CRM tool, if you're using your CRM the right way and effectively, and your staff is doing what they need to do in the CRM tool and dropping them into the right, marketing group and things like that, it's set it and forget it. Once you set it up, it's done. So it's automated, it's easy. When it comes to brawn is more difficult because it requires people, and it requires processes, and it requires training and things like that. So brawn tactics would be actually having your staff physically reach out to leads via a phone call, if they want to send a personal email directly to the patient as well. And this is of course harder to implement because it requires those components, but both are necessary for success with follow-up with your patient leads, right? So you need to have automated follow-up processes in place, and you also need to have those brawn processes manually following up with patient leads as soon as possible as well. So quick example, here we had a text, hey Beauty Warrior, this is Dr. Michael Salazar's practice down in Miami. Hey Beauty Warrior, thanks for reaching out to us. One of your squad doctors will contact you soon. Stay safe and healthy. So something along these lines, you can shoot them a text that's automated from your software, send them an email as well. So the next thing we have is tracking your leads and KPIs on a regular basis. This is probably one of my favorite things to talk about, because this is something else that I feel is very overlooked a lot of the time. And when we're talking about marketing, we cannot, and I touched on this earlier, we cannot have marketing success without actually tracking our leads, right? And believe it or not, less than 10% of aesthetic practices actually track their leads. And I do polling for this all the time, and it is so alarming to me, right? So we're going to talk about this. So less than 10% of aesthetic practices track their leads or business metrics, which is mind-blowing to me. So how much can one lost opportunity cost your practice? We talked about this, whether it's a surgery and it's $32,000 worth of surgery, or even if it's just that Botox patient coming in for their first time treatment. You're not losing that one visit of Botox. You're losing what that lifetime value would be over the next 5, 10, 15 years of that patient coming to you and continually getting treatment. So we kind of want to shift our mind when we do talk about this and always take into consideration lifetime value versus one-time value. So CRM. So CRM stands for Customer Relationship Management Software, or you can call it Patient Relationship Management Software in this industry. And this is truly one of the most important pieces of technology to be using. And I would say in the medical aesthetics industry, I think CRM is still not used as often in practices as it should be. If you go outside of the medical aesthetics industry, in other verticals and fields, you know, CRM is a very mainstream tool. You will not find a sales rep, let's say, you know, a lot of us have capital equipment in our practice. All of those sales reps and all of those laser device manufacturers, they live and breathe within their CRM tool, right? So in other fields, it's a mainstream piece of software that no business can run profitably without. But I feel like in the medical aesthetics field, in terms of practices and healthcare providers, it's still a newer concept. So CRM is not an expensive tool. Our CRM, for example, Aesthetic Now runs $3.99 a month. So it's not a huge investment, but it can do a lot for your practice. So it has call tracking integrated into it. So it will capture and record your phone calls, you know, field all of your website contact forms. From there, you can actually assign opportunity revenue value to your incoming leads. So when you start working those patient leads, you can maybe start with the ones who are worth the most amount of money up front. So kind of being mindful of that. It will house your database of contact info within your database in CRM. You can segment your database into specific marketing groups. So they can be segmented off several different things. So you could have your millennials group, you can have your boomers group, your Gen X, Gen Z, whatever it may be. You can separate it by age. In addition to that, you can separate it by gender. You can separate it by treatments they are interested in, treatments they have already done. So that way you can get very granular and targeted with your marketing messages via email. And of course, text is great to use, but we do not want to abuse text message marketing because it is much more invasive than email. I would say emails, you know, I'm very comfortable receiving promotional emails from practices, from other businesses, and I'm a millennial. It doesn't bother me. Now, texting gets on my nerves when I'm getting blown up by, you know, businesses, you know, telling me about a sale or whatever it may be. It's very irritating to me. So we do want to be mindful of not abusing text message marketing, but email, we can certainly leverage a lot more than text. CRM will also help you, as we touched on, automate that remarketing communication, automate that follow-up communication. So once you set it up in the software, when someone reaches out to you, you put them into that specific group and the automation is triggered, right? So it's set it and forget it. It's certainly a scalable solution that will no doubt save some staff time and therefore increase efficiency. And then of course, the most important thing, tracking your leads and your marketing key performance indicators. So, okay, you know, how is my marketing performing? How many leads did I get from Instagram last month? How many leads did I get from Google last month? How many leads did I get from a referral, whatever it may be, right? Are we tracking that? Are we tracking the conversion rates for each marketing source? What marketing sources are performing the best? Which ones are performing the poorest? So then maybe, you know, the next quarter, we can refine our marketing strategy, pull dollars from one outlet and invest more into another outlet where we know conversion is, you know, 50 times higher, right? So it just helps us measure our marketing performance based on facts, once again, not feelings, so that we can ultimately achieve maximum results. So it's a very powerful piece of technology. CRM, you know, it's a cloud-based piece of technology as well. So for instance, if we have a provider who is on vacation, they can utilize Aesthetic Now on their phone, see what's going on in their practice, listen to what their staff said over the phone call that came in 5 minutes ago. Even if they're in Aruba basking in the sun, whatever it may be, they can still, you know, see what's going on in their practice via their phone. So very great piece of technology. Additionally, as we already touched on, so tracking your leads in real time, so your phone calls, your online forms, these get filtered in, it integrates into your site, helps you manage your potential patient sales pipeline. So how much potential patient opportunity do you have sitting in your practice? practice's pipeline and what's going on with those patients. So what is your sales staff, your front desk doing to actually convert those opportunities into a consultation, and then from there, of course, a booked treatment. The next thing we're going to touch on is selling experiences and results, not products and treatments. So we are selling in aesthetic medicine, we're selling an outcome and a feeling. We're not selling, 60 units of Botox. What we're selling is if someone's interested in their neurotoxin, we're selling what that outcome is. Okay, less wrinkles. They're going to feel so much more confident and beautiful about themselves, things like that. So a couple of quick things in terms of improving consult conversion with potential patient opportunities. I think it's really great to offer patient financing. And the two companies, CareCredit probably has the most brand recognition in this industry. Cherry, I actually love Cherry as well. So for those providers who have not heard of Cherry, they actually will finance as low as $200 and they will finance up to $10,000. It's a very high approval rate. I believe it's over 80%, no additional financing fees. And it's a great piece of technology in terms of patient financing. So offer patient financing to have that avenue, that other avenue, if a patient doesn't have, maybe they don't want to pay for this surgery or this treatment plan up front. Maybe they're a younger millennial, they haven't entered into their prime earning years yet. That doesn't mean that they aren't valuable, because once they do enter into their prime earning years, they will continue to spend money and more money with your business. So we don't want to neglect a patient because at that point in time, maybe they don't have the dollars to spend up front, or maybe, it's someone who's going through a divorce and they have a lot of things going on in their life that are super hectic, but they really want to get this surgery or this treatment series. Offering patient financing is a great avenue to offer in your practice to make it easier to do business with and to cater to those patients as well. I think post-procedure products as well. So of course, medical grade skincare, I don't need to talk about that. We all know the importance of medical grade skincare alongside all of our treatments, especially when it comes to achieving whatever skin goals there are. You can't get all the injectables in the world and then use things from Sephora on your skin that are not medical grade. That's not going to help you achieve your end goal, of course. But a product I've been recommending a lot to practices, and a lot of providers do have it in their practice now, is Oxygenetics. So for those of you, I'm sure a lot of you guys are familiar with this, but I love this product line. It's basically medical grade foundation, and it can cover up a lot of signs that would give a patient social downtime. So whether it's a more invasive or a more aggressive non-invasive procedure like CO2, or whether it's just some bruising from getting Sculptra or dermal filler, Oxygenetics is a great product to have a patient take home with them, or maybe you make it a unique thing that you offer in the practice with your filler and your laser treatments. We also have this great revolutionary product that will actually help you cover up the redness, the bruising, whatever it may be, so that you don't have to experience that social downtime and you can still go on about your normal day, your normal week, your normal month, and people won't know you had a treatment done. So Oxygenetics, it's a great line. It's all medical grade foundation, and they're coming out with concealer, which I know because I've actually been helping them. Full disclosure, I work with Oxygenetics as well, so I've been helping them with their pre-launch of their concealer, which is very exciting. But all of it's medical grade, and it's great for a unique thing to offer to a patient where social downtime might be a problem. Downtime can certainly keep a patient from moving forward with treatment, especially when we are talking about millennials. So great product line for anyone who, and I have no financial interest in it, but if anyone is interested in kind of maybe learning more about it, I think it's a great product to have in your practice. Of course, then we have long-term customized treatment plans that include skincare. We don't, if a patient's coming in, and I work with clients on this all the time on a regular basis, right? So if we have someone coming in for toxin or filler or a hydrofacial, something that's not going to really make us a lot of money, just doing the Botox in their consultation and then saying, okay, Sia, remember to book your appointment in 90 days. That's not how we should be handling it, right? We want to build that long-term relationship. We want to be creating that long-term customized treatment plan. People are buying outcomes. And also this can give your practice a unique and competitive advantage and edge in the industry, because you're not just selling Botox, you're going to sell this comprehensive plan over the next 12 months that is going to get this patient to achieve optimum results. So selling the experience, when we talk about selling the experience, we always talk about perceived value. And perceived value goes with your marketing. It goes with every aspect of your business. But when we talk about perceived value, what this really means is what the perceived benefit is minus the cost. So the perceived benefit is going to be why that patient is coming to you in the first place. So what are they actually trying to solve for? And what do they believe that they are going to receive by getting this surgery, by getting this series of treatments, by completing this 12-month treatment plan? Well, it's typically, most of the time, it's going to be something that is emotional, mental. Of course, it's physical, but physical is going to affect how they feel up here, right? So it's going, if they get this series of, laser treatments and they use this skincare and all of these things, let's say they're very self-conscious about their skin, they have deep lines, they have maybe some melasma and hyperpigmentation, all of these skin concerns, let's say. And let's say they're really self-conscious about it, right? It's affecting how they feel every single day. So they feel if they get this treatment plan, this series, they're going to feel so much more confident, beautiful, handsome. Because of that, they will perform better at work, have a better dating life, a better social life. So the key here is that perceived benefit and that outcome and that feeling and that experience that you're selling. It needs to outweigh whatever that cost is. So if it's $2,000, if it's $5,000, if it's $15,000. So something that we just all need to keep in mind. People aren't buying products, they aren't buying tox, they aren't buying cool sculpting, they aren't buying a syringe of Restylane for their lips or whatever it may be. They're not buying their breast aug. They are buying that feeling, they are buying that experience, right? So we're ultimately selling what perceived value is. And then last but not least, you can't really have any success with your, I don't want to say that, but it's very difficult to achieve maximum ROI if you don't have a unique brand and a unique selling proposition that everyone in your practice fully understands, that they can articulate word for word, and that they actually truly, like, wholeheartedly believe in as well. So having a unique selling proposition. So before you start your marketing, if you're opening up a practice, if you're maybe coming in from the insurance side of medicine and maybe you're going into direct cash pay, you need to cultivate a unique selling proposition, ideally before you open your door. So what does your practice stand for? What are you trying to achieve for your ideal patient? And what is going to differentiate you? So things to think about are what your ideal patient wants. So what type of treatment, or I'm sorry, what type of, not only what types of treatments are you going to offer, but we want to think about what our ideal patient avatar is. So who is our addressable and target patient, right? And a lot of the times, and I say this a lot, is the riches are in the niches, right? So some practices try to be everything to everyone. While that's all great and dandy, if you want to really be spectacular and have that very strong, unique competitive edge and unique selling proposition or unique value proposition, however you want to look at it, it's much better to have a specific niche, right? So what is your ideal patient? Is there a demographic in terms of age range? Maybe are you going to be the cheapest in town, or are you going to be one of the ones that charges based on your expertise and experience in the practice, right? A lot of us don't want the patient that is constantly hunting down Groupons to find $8.99 per unit Botox, right? While we might think, oh gosh, that's really annoying because the practice across the street from me has this really cheap per unit Botox, and maybe their syringes of filler cost less. We can't think that that's really competition, because are those the types of patients that we would want in our practice if we're trying to be a more luxurious experience based on or versus the practice across the street that their unique value proposition is price. Typically don't want to be the cheapest in town, right? So just some things to think about. What is our ideal patient? What our competition does well? If what they do well is that they're the cheapest, okay, that's great for them. We're not going to be that, right? We are going to do a stellar job of selling that experience, that outcome, those comprehensive treatment plans, our membership program, that is based around our unique approach to aesthetic medicine and what we achieve for our patients. And when we talk about unique selling proposition, this falls down to having that brand, right? And when we talk about, and I talk about branding a lot, and the $1 million question I would ask all of you guys is, you know, truly, if you just think about it for a second, how many of you guys actually think you have a unique brand? And I ask this question all the time too. And typically if I'm on stage and I ask this question, everyone's hands shoot up. Everyone thinks they have a unique brand. And I hear this all the time. Oh, Audrey, you don't understand. My practice is very unique. And it very well may be. But what I would ask back to you is, okay, so let me ask you a question. If I were to come into your practice today and take every single staff member, whether it's 5 or 50, into a separate room and ask them each individually, what is your practice's unique selling proposition, or what is your brand? Would they all say the exact same thing? And if you're thinking no, I would say, you know what, you're right, your brand is unique because you're the only one who knows what it is. So that's something that we need to think about, having not only what our unique selling proposition is, and it should be no more, I would say 3 sentences max. I wouldn't even do it as far as 3 sentences. Ideally, it would be 1 sentence, 1 to 2 sentences. But not only does everyone need to be trained on what that unique selling proposition is, and they can articulate it no matter what, but they also need to actually believe in it as well. And when we talk about belief, that's a culture thing, right? That's a culture component in your problem. If you have toxic culture and you're turning and burning employees all the time, you're not providing the proper training, you're not paying them the right way, there's no motivation in the practice, they don't feel like they're really responsible for growth. Everyone should feel like in their role that they are responsible for growth, right? It's going to be in different capacities, of course, but you know, creating that drink the Kool-Aid moment and culture in your practice is going to go hand in hand with believing and having that unique selling proposition. And this is going to help in all facets of your practice, answering the phone, in the consultation, in your marketing, in your social media, all of that stuff. So just some things we want to keep in mind. And for anyone actually who does, if you don't have a unique selling proposition, I have this like I call it creating a USP for dummies, even though none of us are dummies, of course, but that's what I call it. But it's a quick little like 2-page exercise that you can do to help develop what your unique selling proposition is in the practice. So if anyone does want that, I'll throw my contact info at the end, and you can shoot me an email and I can send it over to you. So quick case study as we wind down here. So meet Samantha, 28 years old, so she's a millennial. She's single, income above 85,000. Maybe it's 90, maybe it's 100, cares about health, beauty, and appearance. She's interested in wrinkle relaxers and other aesthetic treatments to improve skin texture as well as her skin health. So what is the cost of a lost patient opportunity? And I was very conservative with these numbers as well. So let's say Samantha reaches out, or actually let's say she goes on Google. She starts doing her due diligence, toxin, Botox near me, finds your practice. You're on the first page. She goes to your website, looks at your reviews, your before and afters, reads about your providers, watches a video, goes to your Instagram, starts kind of going through the content on your Instagram and social proofing you. And she finally determines that, okay, I'm really excited. This looks like someone I can go to start my aesthetic journey. I'm going to reach out to this practice. So let's say she comes in initially for just toxin or filler, okay? Or maybe she reaches out on an online form because you have the right follow-up process in place, because we were utilizing CRM effectively to convert her into that consult, because you had the right sales training, you have the right treatment protocols in the practice. Let's say she comes in for just injectables and she ends up getting on this comprehensive 12-month treatment plan. And I was, once again, conservative with these numbers and conservative with these treatments. So let's just talk about bare minimum. So let's say she, you know, she's going to do her toxin every 90 days. Great. $2,000 bucks, let's say, for the year. Dermal filler, let's say she gets 2 syringes, maybe 1 in her cheeks, or 2 in her cheeks, and 1 in her lip and 1 in her chin, whatever it may be. 1,700 bucks. Let's say she's recommended to come in monthly for Diamond Glow or Hydrofacial. And in addition to that, medical grade skincare. These are the products that you need to be using in conjunction with this series of treatments that you're going to consistently come back to see us to get. So she's going to stay therapeutic. She's going to, of course, get better results. She's going to achieve that outcome that she was really trying to come in for initially. But we all know injectables are not going to solve the immediate issue when it comes to overall skin health. Now, if it's something like, I want bigger lips, okay, yeah, of course, 1 syringe, 2 syringe of lip filler can solve for that. But when we're talking about overall skin health and things like that, it's going to take a combination of things, of course. So that's, the math here is wrong, but 6,500, let's say in routine aesthetic treatments, it's higher than that. So 28 years old, so 7-year time span, let's just say for the sake of this, the math was right. I ended up changing some of these numbers, so that was why. So let's just say it's $50,000, give or take, as a 7-year value of a potential patient opportunity. So this could have been $50,000 that you lost by dropping the ball on the phone call, by dropping the ball in the consultation, by dropping the ball by not following up, right? So there's so many different conversion series that we actually need to excel at to move forward, right? And then if we do everything right, and for every patient, every time, you know, the sky is truly the limit. So is the juice worth the squeeze? So quick look at an average practice versus a great practice. This was a case study we did probably 5 years ago. So this is a while ago, but it's still very powerful today when we talk about this specific topic. So practice A receives 100 inbound phone calls and forms, 40 of which are new opportunities. Their staff is converting at 25%, okay? Average treatment, so they acquired 10 patients, average treatment revenue $1,000, monthly treatment revenue 10 grand, annual treatment revenue 120. So maybe they were coming in for a syringe of filler. So practice B down the road, same amount of inbound opportunities, but their staff's converting at 45%, which I would still say is not the best. You can still convert at higher than 45%. I would ideally convert it. I would say your conversion should be at least 60. So new patients acquired 18, average treatment revenue, same treatment, monthly treatment revenue 18K, annual treatment $216,000. So almost double than practice A. And once again, this boils down to facts versus feelings, right? Because there's a difference between saying, oh, I feel like my people are amazing, or I feel like my people are great on the phone, versus I know my people are great on the phone, right? Two totally different things. And when we talk about marketing and conversion and our key performance indicators and success and ROI, that's always going to boil down to facts, not feelings. So at the end of the day, what type of practice do you want to be? What do you need to do, and when would be a good time to start? I would say today would be a great time to start, right? Monday morning, whatever it may be. And then it always comes back to belief. And I end every single you know, presentation I give with this, because it doesn't matter what I believe. I believe all of you guys can do it. So thank you guys all so much for, you know, spending 2 hours of your time on a Friday afternoon with both Dr. Kaplan and I. But at the end of the day, it doesn't matter what I believe. It only matters what you believe, right? So thank you guys so much. I will throw my contact info is here on the screen. So if anyone has any questions about anything I touched on, or you know, you're interested in looking at our CRM or whatever it may be, our marketing services, or if not, if you just have any questions or any feedback or constructive criticism, I take everything. Feel free to shoot me an email. If you're a texter, texting is a-okay with me as well. A lot of people prefer to text. You can shoot me a text as well. But other than that, you guys, I want to say thank you. And we will see if we'll give it another minute to see if anyone has any questions for either myself or Dr. Kaplan. And if you guys don't feel like asking questions, that's okay. Hopefully you guys all enjoy your Friday. When you get back from your practice, enjoy a glass of wine. Hopefully you had a nice productive week, but we'll give it another minute or so.
Great presentation, Audrey. Really enjoy hearing you speak on all those topics. It's a lot of information, but it's all so accurate and so dead on. Really great.
Thank you.
And I've never really thought about that as far as the CRM. You're right. It's not not saturated by any means in the aesthetic industry. It's every other industry uses CRMs, but plastic surgeons, aesthetic providers, whatever, they're not using the CRM to the fullest. It's really kind of fascinating how that hasn't penetrated this market as much as it should have.
Yep, it's very true. And a lot of times I would say, like, the biggest thing for those who are, there are practices out there that track their leads, of course. And the biggest Okay, so how do you track your leads? The most common answer I get is, oh, we put them in a spreadsheet, which is better than not using anything to track.
Nothing. That's right. It's better than nothing.
Yeah, at the end of the day, it's certainly not scalable, but it's better than not tracking your leads. But CRM would certainly be an upgrade from an Excel spreadsheet.
All right. Well, they can, again, y'all can email me too at jonathan@buildmybod.com. Thanks so much again for having me, Audrey. I really appreciate it.
Absolutely. Thank you so much. Have a great Friday.
You too.